So first off, I'm gonna show you my scrubs of the day. So these are, where's the tag? These are Grey's Anatomy, which is my favorite scrub brand. I do wanna try Figs, but this is just like, I'm not sure if this is considered the athletic top. I don't think it is, because usually it has like another, like it says active wear or something. It's got 3 pockets. I usually keep my pen in this one, and then I keep like gloves and all kinds of other stuff, scissors and stuff in this one. And then for pants, I like joggers. These aren't joggers, but these are skinny pants. So I typically wear joggers, but these are just the skinny pants. And what I really like is having this pocket here. I always keep my phone in here or my scissors in here, and it's really handy. So these are my scrubs of the day. Hey everyone, so I'm back. I have to apologize. I started this channel and I didn't realize I was getting the feedback that I was from that video that I posted. I think there was just one, but I didn't realize the interaction that I was receiving. So now that I went back and looked, I'm like, I could have been making videos this whole time. So I hope that some of you have stuck around. I just want to first off apologize for not making videos. But today I want to talk about the struggles and the benefits of being an LVN. So stick around. So we're going to save the best for last, and I'm going to start with the struggles. So the very first struggle that a lot of you may or may not know is in the medical field in general, because I was an EMT before I was an LVN, you have long days and long hours. Now, not all LVNs work 12-hour shifts. Some of my jobs have been 12-hour shifts and some of them have been 8. A lot of the 8-hour shifts come from doctor's offices and nursing homes, so keep that in mind. But when you have 12-hour shifts, it is long, it does suck. For me, I get really bad migraines, and that's just a super long time to continue having noise and stress when you have a migraine. So you have to keep that in mind. I know at first, if you're used to an 8-hour job or 8-hour class time, you might feel like you're gonna go into shock from having 12-hour shifts at a job. But honestly, you adjust pretty well, and you're so busy that by the time the 8 hours passes and the 12 hours comes, you're really doing okay at that point, and the day just kind of flies by after the 8 hours. So try not to look at the clock too much, and that'll help that issue, but you can do it. We all do. It does suck at first, but you'll get through it, I promise. So second on my list of struggles is nurses tend to be, at least at the jobs that I've worked at as an LVN, we tend to be short staff. Now this is because of a couple of reasons. So turnover rates for LVNs, especially in nursing homes, are very high. A lot of people won't stick around for long, they can't really handle the job for long, and they will leave. Or just in general, LVNs have a reputation of kind of jumping from job to job after a little bit of time. So especially in nursing homes, a lot of people will stay maybe a year, sometimes 2, usually a lot less. And so because of that turnover rate, it causes your facility to be understaffed. Now, even if you're properly staffed in your facility, there tends to be a lot of call-offs because of burnout and because we are constantly working. So if we have anything to do, or if we feel sick, or if our children are sick, we have no choice but to call off. So when somebody calls off, it really messes up everybody else's schedule, because somebody has to take that place. Where, I don't know, I've never worked not in the medical field except when I was 16 and I worked in a movie theater. But I've never worked in an office or, you know, a traditional job where if you call off, you call off. You know, somebody might have to pick up your slack a little bit, but it's no big deal really. From my understanding, at least with my friends and significant other and everything. But I will tell you, it's much different. With nursing, those patients are required to have a nurse unless you work in a doctor's office or urgent care. If you work in a facility that is long-term or short-term care, those residents are required to have nursing care 24/7. So when you come on, you're relieving the nurse that is leaving. And when you leave, someone has to relieve you. So if you call off, there's nobody to relieve that person that you were relieving. So they have to now find somebody to relieve them and make sure, you know, that the hours and everything is good. So that's different from a traditional job, and you might not know that. You know, you could have the worst day of your life, but if the person after you calls off, you are stuck at work. And for our laws, we're required, if this was to happen and they absolutely couldn't find somebody, if that happens, we are required to stay 2 to 4 hours over our shift in order to provide care to our patients that need 24-hour nursing care. So you will be stuck at work. There will be many times where the person after you calls off, and until they find somebody, you absolutely have to stay there. It doesn't matter if you are busy, doesn't matter what's going on, if you are tired or hungry, does not matter. You are required to stay because your residents need 24-hour nursing care, and you are abandoning your patients if you leave with no nurse relieving you. So just know that a lot of bosses will really try to find somebody and not have you stay over 2 to 4 hours, because wouldn't everybody quit if that happened all the time? So I will say personally, I've been held over 4 hours, 1 hour, 2 hours, but I'm always asked. Without it, had I said no, the most I've been held over, when I say no, I cannot stay 4 hours over, the most I'm held over is usually like 1 hour, just because they absolutely have to find somebody. And once they call them, that person has to get ready, and that person might not live close, and they have to come to the facility. So, you know, by that time, it's about an hour. So you really have to be willing to help out. That's really how you gain from your job and get really good with your boss, is as a nurse, you have to be willing to help out sometimes. So if you're constantly saying no, chances are your boss is not going to give you a raise. Chances are your boss is not going to give you the day off that you requested. So just keep that in mind, because, you know, we're all a team, and we have to work together, and we have to be willing to help out. Next on the list, because we have long hours and because of our job title, we are standing for long periods of time, especially in a nursing home. So at my previous job, that in my previous video I was speaking about, I only had 6 patients in a home, and I had my 2 CNAs. I was able to sit a lot. I only had 6 patients. I was night shift. It's a little bit different. In a nursing home, you do not get to sit much. You do not always get a lunch. You do not always get a break. It just doesn't work like that. And because of that, I find myself in pain a lot in my legs, my hips. Like I said, I always have migraines. So you really have to take care of yourself. If you see nurses with big Yeti cups and water jugs, that's because if we don't stay hydrated, we cannot function, and we will get massive headaches and body aches. So that's really important when you're working as an LVN. Now, next on the list is something I hate speaking about because it's not fair, but we're not always looked at as professional nurses. We're not always looked at as educated nurses. Because we're an LVN and we do work under RNs, we're not always treated like we are a nurse. Some say we're treated as half of a nurse. I've never heard anybody use that term to me or around me or anything, but it is true that you're not treated exactly how an RN is treated. Now, some people that don't really have medical knowledge, they will full on treat you like you deserve to be treated as a nurse. But people who know that you work under the RN will kind of jab at you and say, well, I want to speak to the RN about this. Even though you're the charge nurse and you make the decisions and you fix the problems, you will have those people that just look at you as nothing, and it sucks. But just know that you are a nurse, you are important, and you do your job. And there are just those people that just really just want to keep going up and up and up and up on the list. Even once they speak to the RNs when there's an issue, you know, typically they want to speak to somebody higher and then higher and then higher. So it's just kind of like they just want to get people in trouble sometimes. It's not, you can't take things so personal. That's the thing in nursing. This is another struggle that I wanted to bring up, so I'll tie it in with this one. Patients and family members are going to treat you bad sometimes. You are going to have those patients that cuss you out, that hit you, that just talk to you terribly, that are non-compliant. They're not going to allow you to give their medication. They're not going to allow you to do their treatment. They're not going to be compliant with really anything. And it's just because they're upset at their situation and maybe they feel like nobody's there for them and nobody really cares. And a lot of the time you can try to work through that by being compassionate and just acting as a friend and not so much just as their nurse, and really digging deeper on a psychological level and helping them typically helps that. But there are some people, there are some patients, and there are some family members that you cannot get through to, that no matter how hard you try, every day they have an issue. Every day they're complaining about this, and that, about this person, that person, you, and it's just always something. They're always looking for trouble, and you can't change that. You have to remain professional. You have to continue helping them. You just have to continue doing your job even when you're being yelled at. So that is a struggle. Especially for me, because I'm so nice to everybody, and I talk to people in a kind way. I really try to solve every issue as best I can, and I really take a lot of time with my patients. I don't just ignore somebody's request or complaint, and I take things personally, and sometimes you can't help that. But if you're going to be a nurse, you have to be tough, and you have to be able to not take everything home with you, because that's really important. So keep that in mind as well. Next, I want to talk about doctors. Now, I have had a fair share of wonderful doctors that just act like your best friend, and they're just so cool, and they trust you with every recommendation that you may have. Like, hey, can we start this patient on this? I think the patient would benefit from this. And they really take into consideration what you're saying, because ultimately, some people don't realize this, especially when you're not in the medical field. Ultimately, you're with that patient every day. You know that patient inside and out. That doctor, they read the charts, they do their research, they might deal with that patient on a weekly basis and, kind of know the patient, but you see that patient every single day. You do care on that patient, and that's just it. We might have some recommendations for what patient care could be and what a treatment plan could be. And some doctors will take into consideration, most doctors will take into consideration when you say, hey doc, can we try this medication? Or maybe not even that specific. Can we maybe try an antidepressant because this patient is showing me signs of depression? Or can we treat this wound with this? Or can we do this? Or whatever. A lot of the time, the doctors will just give you a quick yes. And sometimes the doctors can be very mean. And like I said, I take things personally. I don't mean to, but that's my son, sorry. I don't mean to, but I'm just a kind person, and it's just hurtful when people aren't kind to me. And it's something that, as tough as I am, sometimes I just can't help it. And when a doctor yells at you and basically calls you stupid, that is very, very hurtful. Now, I've never been called stupid by a doctor, but I know many people who have. I know many people who've been cussed out. I know that in my personal experience, a lot of doctors have made me feel stupid just from talking to them on the phone, telling them what's going on with the patient. And they're like, why are you calling me about this? This is not a big deal. And they make me feel stupid. And that's not a good feeling, but just know at the end of the day, it is better to report something to a doctor than to not. But I can go into specifics in a different video, but when you are questioning whether or not you should let the doctor know, if you should even bother the doctor on a Saturday night about this, a lot of the time, you know, a text message is good enough. And a lot of doctors text nowadays. But don't call the doctor for every little thing. Otherwise, you might be talked to like you're stupid, because no doctor wants to be called on a Saturday night at midnight about a patient that's constipated. That's just how it is. So one more disadvantage or struggle that I wanted to mention is nursing is not always glamorous. You are not always, you know, looking cute and wearing scrubs and, you know, with your stethoscope around your neck. It's not always like that, okay? If you're a good nurse, you're gonna help your CNAs, and if your CNAs are busy, you're gonna do it yourself. What I mean is changing a patient, cleaning a patient's mouth, oral care, you name it. You're gonna do these things because you're a nurse and that's what you're there to do. This patient's helpless and this patient's dirty, you need to clean them up. That is not glamorous. I have smelt things that I wish I never smelled before. I've seen things that I wish I'd never seen before in wound care, but that's part of it. And you'll realize that. And you know what? I'm insensitive towards it now. I just do it and I don't even think twice about it. It was never like, oh my gosh, that's really gross to me, but to some people it might be. But if it is that way, I would say it gets better because you're going to be doing this so much. Do not think that even if you go straight for RN, do not think that you are not going to be helping your CNA, because you are. Do not think that only CNAs clean people up. That's not true. Only CNAs shower people. That's not true. You're going to need to do it one day, so know how to do it and be okay with doing it and get over it, because this patient is helpless. So that's something that a lot of people can't handle. And by it not being glamorous, I'm not just talking about changing. I'm not talking about wounds. I'm also talking about blood. You're going to see a lot of blood. You have to be okay with that. A lot of people are like, oh, I'm so scared of blood, or I'm so grossed out of blood. I don't think this is the right field for you, but you can try it and you're going to see so much of it. Maybe it won't even bother you after a little while. I don't know. I was never like that, and I don't know anybody that was like that and is a nurse, but I'm going to assume that after a while you're going to be okay, because you're going to see this so many times in one day, it's not even going to matter anymore. So there's that. So that's going to be it for this video's struggles, but let's talk about the benefits, okay? It gets better. There are good parts about this, I promise. So the number one thing that you have to keep in mind when you're considering nursing, or when you feel burnt out of nursing, is you will always have a job. You will always have a job, whether that be the job that you're at, or if you have to find a new one, I promise you it won't take you long. There's always a job for a nurse. LVNs are limited to where we can work, and I talked about that in my previous video, but you will always have a job. Look what's going on in the world right now, COVID-19, and did we get to stay home and like everybody else besides, you know, grocery store workers and bank tellers and everyone else that was able to stay, obviously sheriffs and fire and everything, but the medical professionals in general, we still were out there working. We still had a job. I was so thankful when we were still, me and my fiance both still were working during COVID-19. We're both in the medical industry. And that was such a blessing because a lot of people were waiting on their unemployment, were, you know, not hearing anything back, were stressing. And, you know, that was most of the people in the United States, I feel like. But we didn't have to worry because we still had a job. Now, things, you know, have been a little bit different. We have less patients now, less building census, which that means we have less patients because we're not getting as many admissions as we would normally. So where this causes a problem is we have too many nurses coming to work and not enough patients to have so many nurses being paid. So what they do is they flex some of the nurses after 4 hours or even cancel. Like today I got canceled. Cancel your entire shift because there is just not enough patients to pay for all of these nurses to come to work. So that is a disadvantage, but we're still working, we're still getting paid, and you know, I couldn't be more thankful for that. And that is huge when you're looking into a career. You don't ever have to worry about whether or not you're gonna find a job, because you will. So that's just amazing on its own. But I have a couple more. You are going to make a difference. You are going to have those people that make you feel like you're not making a difference, and maybe even those jobs and those toxic coworkers, maybe a toxic boss. I've had that before. They're gonna make you feel like you're not doing anything. But at the end of the day, you know that you are helping one of those patients' lives, if not all of those patients' lives. And you know that whether or not they're improving or deteriorating, you know that you're making a difference because you're going to work, you're talking to these people, you're treating them kindly. You're there even during COVID-19 when nobody else wants to be out right now. You're there taking care of them, protecting them, making sure that they don't get that sickness. And, you know, you're making a difference. Whether anybody else wants to tell you that or not, I'm gonna tell you that we all make a difference. Our CNAs make a difference. Our LVNs make a difference. Our RNs make a difference. The doctors make a difference. We all are a team and we all do this. Physical therapy, respiratory therapy, all of us, okay? Don't ever forget that. And lastly, for, you know, the major benefits of being an LVN or being a nurse in general is you can choose your field. Now with LVNs, this is limited, but as a nurse, there is endless fields that you can choose from. It's not like, I can't even give an example. I don't even know. Like I said, I've never had like a traditional job, but you get to choose. Do you want to do labor and delivery? Do you want to work in a doctor's office? Do you want to do orthopedic? Do you want to do respiratory? I'm a respiratory nurse. Do you want to do ICU, respiratory? Do you want to do ER? Do you want to do med surg? Do you want to work with oncology patients, pediatric patients, geriatric patients, bariatric patients? Whatever you want to do, you can do that. You can choose that. There's endless options for us. There is more for RNs, obviously. Like, you know, we can't work in labor and delivery, at least at my hospital. And that is my ultimate dream. And that is why I want to be an RN, because I want to work in labor and delivery and or ER. I can work in the ER as an LVN, and there's so many options, and that's what makes it so amazing, because you do get burnt out. And when you get burnt out, move to a different field in nursing, because it is draining, and everybody knows that. And maybe the field that you're in is not working for you, and maybe you have to be in a different field because you're a different type of person, and that's perfectly fine. And I've been there, I've done that, and I've found what I enjoy, and that's respiratory. And there's just so many options. There has to be something that fits right for you. Okay, so that's gonna be it for the struggles and benefits of being an LVN. I am so excited to kickstart this channel again, and I hope that you will join the family. Thanks for watching. Bye, guys.